First quarter stats for this year's fentanyl-related deaths are definitive. The crisis is not abating. Of tremendous concern is that of the 113 fatalities in the first 3 months of this year, almost 20% are due to carfentanil. When asked last month what this government is doing to address the public awareness about carfentanil, the minister said it had, quote, released a report, unquote.
Wow.
We now have another report, and the fentanyl has taken even more lives. Minister, clearly reports are not enough. Why are you not declaring a public health emergency?
Good question.
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the very important question. This crisis is devastating for all Albertans, for families, communities, and of course for victims. And that's why this year alone, our government is investing $56 million in support of treatment and prevention. With that money, we're going to be expanding the access to life-saving naloxone kits, as well as expanding access to supervised consumption services and other wraparound services, plus expanding access to opioid dependency treatment, which is considered best practice when helping people deal with an addiction.
Mr. Speaker, this is an emergency. Given that there have been incidents around North America that have seen first responders fall ill at overdose scenes involving carfentanil, and given that with 50 carfentanil deaths in Alberta over the past 15 months, the danger to our frontline emergency workers is extreme. And given that Alberta created the first known test to detect carfentanil in blood, which allows this government to act nimbly upon learning that its presence is in specific areas, to the same minister, why have you not raised the urgent alarm about the grave public health emergency in carfentanil?
The Honourable Associate Minister.
Thank you, Mr. Speaker, and to the member for the question. Our government is committed to working in close partnership with members in law enforcement as well as other first responders. We are working really hard to make sure that they've got the tools that they need to do their jobs, as well as to keep themselves safe in any situation where there might be carfentanil present. That is why we've worked to expand access to naloxone kits for first responders, which was leadership taken by this government in order to address this crisis.
Second supplemental.
The opposition has been calling upon the province to declare a public health emergency to create a coordinated response to this epidemic.
Right.
And given that we have been assured that there is no need to make that declaration because coordination is occurring,
Really?
and given that the Justice Minister said in estimates that police services are not required to share information with the province, so coordination is not happening then. But what is happening is that Albertans are dying, Mr. Speaker. Premier, will you show leadership here and order your minister to launch a coordinated attack on this crisis?
Do it.
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the opportunity to further highlight some of the work that our government has been doing as part of our coordinated response to this. The Chief Medical Officer of Health in Alberta has been leading our response and is best suited to do so as a leading epidemiologist in our province. Further, we've been working with partners in community as well as partnerships with law enforcement and other first responders, increasing access to naloxone, which has saved lives. There were 1,130 reports of life-saving reversals last quarter alone, Mr. Speaker. And we are going to continue to do that work in partnership, continuing to share data and move forward.